So there are a number of barriers that we observe to sort of wider adoption of pathways. And one of the most important is physician uncertainty. Physicians don't like the concept of cookbook medicine. First you do this, then you do this, then you do something else. Now, in many cases, that may be the optimal way to help the patient. But if the physician feels there are extenuating circumstances, unique characteristics of that patient, then they want to feel that there's flexibility. And the good news is, for many of the groups that are sort of monitoring and rewarding physicians for compliance, they're not asking for 100% compliance. Actually, the number that we often see is sort of 85%, so that 15% of the patients, for reasons that are clinically very important, different approaches might be necessary. On the IT front, that's a whole other barrier, which is, you're seeing your patient, what is the pathway, what are the things I need to consider? And so having electronic health records that would then bring up the pathway and make certain that the elements of the pathway would actually be reimbursed by the insurance company, there's a lot of barriers related to that. Pathways are a young enterprise, and so the barriers, I think, are being more quickly identified than the problems solved.